Hello, everyone. So, so when Dr. Gazit invited me to speak about climate change, migration, and health, I thought about Clara. On March 14, 2019, Cyclone Idai made landfall in Zimbabwe, Mozambique, and Malawi on the southern coast of Africa, considered at the time one of the most destructive cyclones to ever recorded in the southern hemisphere. Idai left death and devastation in its wake. This was only a few weeks after I left Malawi, so I immediately tried to contact my partners on a study of an HIV clinic in rural Malawi to check up on them during the cyclone. When networks were back, and it took a little bit of time, they told stories of strong winds, heavy rains, mudslides, and broken limbs. This was a hospital after all. Also spoken was the fear of the hunger to come, with so much of the crops being washed away by the storm. Going back to Malawi in August of the same year, the damages of the storm were still noticeable, as well as its long-term effect on people. The manager of the welfare program took me on home visits, and this was when I was told of Clara. Clara was a woman in her 30s and a patient at the HIV clinic. Clara lived with her family in a remote village serviced by the clinic. And though she was widowed and the sole provider of her family, she made sure to make her way to the clinic every 3 months to collect her medications for HIV, and was described by the clinic staff as always being high-spirited and optimistic. She discovered her HIV status when she was pregnant, and with a memory of all the babies lost to HIV, she was just grateful to receive care and have a healthy baby. When the storm hit, Clara's house was washed away, and so were the crops in her small plot of land, her only source of income. The roads and bridges leading to her village were also damaged. And when the quiet after the storm arrived, she realized she could no longer live in the house and support her family. Lacking the resources to rebuild her house and recover her crops, she packed her few belongings and her children and moved away to stay with relatives out of district. Her plan was to one day return with her relative to rebuild the house and replant the garden. When the clinic reopened after delays caused by the damaged road and broken bridges, the staff noticed Clara's absence. They contacted her neighbors, who told them what had happened to Clara, but were unable to reach her and didn't know where she went. No one was sure where she was, and the staff didn't know if she re-registered at another HIV clinic in the country. With so much instability, the staff hoped that she found the time to do so. Months went by, and the staff changed Clara's status at the clinic from active to lost to follow-up, which is the demarcation of HIV patients who have disappeared and no one knows where they are. Clara's story was only one of the many told on that visit. It holds the story of illness, poverty, climate disasters, and health. It's also the story of an already resource-limited healthcare systems trying, and not always succeeding, to respond and adapt to climate change events. And migration. Clara and many others like her are the reason why I joined others and dragged other people to join me. One of our students was here earlier. To study the impact of climate change on health services in resource-limited settings. Little did we know at the time of Idai that Anna, the next tropical storms in 2022, will bring a cholera outbreak that will last over a year and into Freddy, the storm of 2023, and stretch the capacity of health services even more than Idai ever did. And this is how I came to think about climate change, climate migration, and other events through Clara and many other people. But I think a lot of the global conversation on climate migration and health actually happened with COVID. Because one thing that COVID did in the field of health is bring up all the things we knew were happening before, but no one bothered to discuss. And in many ways, at least in the field of public health, COVID was this huge, frustrating, we told you so. A lot of the phenomena that seemed new during COVID were actually things that we knew about before COVID, but were not really spoken outside of public health circles. So this was published by IOM during COVID, trying to address the issues of COVID and health and migration. And it's a starting point in a way for a few things that I want to talk about under the umbrella of thinking about climate migration and health. I want to talk a little bit about health because I know I'm probably the only person coming from the health field, right? Okay, so I'm going to spend, yes, so we're two. So I'm just going to talk 2 seconds about what I mean when I say health. I want to talk about climate change and health, migration and health, and then migrants and health system. And just a few concluding thoughts. Like many other people in this room, I don't really have solutions. I have ideas and thoughts. So this is the definition of health by the WHO. And every time this comes up, my students at BGU starts laughing because pretty much every course in public health starts with this. What is the definition of health? Health refers not merely to the absence of disease, but to the state of physical, social, and psychological well-being. Medical students hate this definition, which is why we hammer it in medical schools as well. But the idea is to think about health not just as the presence and absence of disease, but it's something much broader. Now, if we have, and it's great to be in the last panel because everyone talked about migration and climate change, and I feel like we have all the background to have the conversation about health, but also remember that in the context of climate migration, we're not just talking about being healthy or being sick, but about well-being, which makes the whole conversation a lot more complicated. So this is our starting point, talking about health that is more than just the presence of absence of disease, but about health as well-being. And this is, and I loved the sort of your response into questions of, I don't know if it was climate denialism or is it really happening? It's like, this is the starting point. This is what we know. So I'm not going to have a conversation about are there effects of climate change on health? Because we know that there are. And we can have a conversation. We're not going to have it here. Is it man-made or not? But the fact is that we know that climate change affects health. It affects vulnerability. It has direct effects, heat strokes. It has indirect, or being washed away by flood, or indirect effect of vector-borne diseases, and food insecurity, which is also an indirect but very alive influence. So this is for us when we talk about what health system are trying to do or are able and unable to do. This is our starting point. There is an issue that needs to be addressed, and the more resource affluent the healthcare system is, the more capacity it has to adapt to these issues. Now, as someone coming from the Negev, I can tell you that even in our very good healthcare system, and I know we tend to complain about it, I do too, but compared to other countries, we have a very strong and established healthcare system. We're also struggling to figure out how to respond and how to adapt and in what ways, and who are the populations that we need to address. So this is definitely the case in Malawi, for example, which was my sort of, I'm an anthropologist, so we started with a snapshot, where the healthcare system operates on a merely $80 per person per year in terms of the health expenditure. So this is how much money the government has per person per year, which doesn't even keep the lights on, right? Sorry, not COVID. Seriously, I checked. But I can give you all kinds of other things. So I want to say a few words about, I'm sorry. Yeah. Also not TB, which is what they ask you when you come to the clinic in Malawi. It's like, how long have you been coughing? Not 3 weeks, we're good. So I want to say a few words about migrants and health. And this, it came up so many times today, the short and long-term effects of climate change on health. So there are the broken limbs after a flood, and these are very immediate but short-term effects. If you got the proper care, you will recover and move on. And then the long-term effect, it could be as broad as the impact of food insecurity over time, but also trauma and depression as part of the process of displacement. So when we talk about the impact of health, we're talking about a lot of different things happening to people. And we see it as health providers, or I'm not a clinician, so I'm kind of reluctant to call myself a health provider, but in the health provision context, we see it everywhere. So we see it with the families who've been coping with food insecurity for a prolonged period of time, to increase in malaria rates because of changing patterns of vectors. So more mosquitoes in areas that didn't used to have mosquitoes, and now we're seeing more malaria in those areas, but also broken arms and legs immediately after the flood. So we're seeing all these effects, but we're also seeing what is known in the migration literature, the healthy migrant effect. And I loved it when earlier today people talked about the ones who migrate and the ones who don't migrate. Shahar Livne, she's a PhD student at BGU. She was sitting right there until half an hour ago. Did her field work after Idai, after the storm that I just mentioned. And one thing that was very clear is who could not afford to move. So 6 months after the cyclone, you go back to the village, and the people with the ruined homes who couldn't live are exactly who you think they would be. There are the older women, the widow, the mentally ill, the people with chronic diseases, the people who are caring for disabled children. They're the ones who are unable to move even if they wanted to. So those who move are often those who are able to move. And we sort of think of the migrants and vulnerable, but sometimes it's also important to remember that the ones who are the most vulnerable are the ones who are not moving, and the ones that are staying in the community and require extra care from the community, but also from health and wealth services. And a lot of the main health problems that we're seeing are attributed to the long-term and short-term effect of climate change, but also to the migration process. So what we often see when there's a storm in another district is the people coming through our hospital because they hate to migrate. And here, because I work in rural areas, a lot of what we see is rural to rural. I imagine that if I were in a hospital in the city, we would have been seen something different. But the region where I do most of my work in Malawi is on the border with Mozambique. So we see people moving from sort of nearby districts in Freddy, the latest storm, which hit mostly urban areas in the south, so the big fantastic city of Blantyre. Because the cyclone hit the city so hard, people ran back to the villages because the city was just, parts of the city were washed away. And a lot of what you see is these health that was made worse by the migration process. People like Clara, who stopped going to the clinic for a few months because they moved to a new district, or because she moved to Mozambique, and Mozambique doesn't have universal access to HIV care. So as long as she was staying in Mozambique, she didn't have her drugs. And only when she went back to Malawi was she able to get back on treatment. So some of the effects of health have to do with the actual migration process. And part of the problem is the fragmented care toward the process of movement. So people move from one place to another, they move to a new district. In our world of HIV, you have to be registered. So if you don't register, you have to look for a clinic that will register you. So there's the fragmentation that happens. Another aspect of fragmentation is, if the bridges are washed away, and you are unable to go back to the clinic for a month, and the clinic cannot come to you in outreach because there is no bridge, then part of the problem of fragmentation is that you can't get to your healthcare services. One of the districts in our area in Malawi that was hit during the second cyclone, so Anat 2022, is Chikwawa district, and most of the district is located between two rivers. So there are people who are just stuck in the middle, and health services couldn't come to them, and the health services in the center part of the region at some point just, well, first of all, the buildings themselves were damaged, but also at some point they lost stock because no one was coming to restock them. So there is fragmentation of the process of healthcare in a healthcare system that has $80 per person per year. So care is somewhat fragmented, even on a good day. And then there's limited access to care in transition and destination. Now, I'm speaking mostly about domestic migrants, which is what we've mentioned. I think people think about this mostly when they think about international migration. You get to a new country, if you don't get a good refugee package, that you're not going to have access to healthcare service. Think about Israel, for example, right? When you're going to end up relying on NGOs to get healthcare services because you're not really covered by the state and you don't have a good package as a migrant, versus Germany, once you're recognized, you will get the full package or somewhat of a full package. But even for domestic migrants, you need to know where to go in order to get your services. And sometimes you need to pay. And sometimes you're moving. If you talk to healthcare providers that work in transitional camps, they will tell you of people who come with like a lot of notes from a lot of doctors they've seen along the way. And in a hospital we worked in, thank you, I appreciate it. So it wasn't really climate migration, but it's a good example. I worked with colleagues in a hospital in Burundi in 2011 when some people were coming back. So refugees were coming back or being pushed back from Tanzania. And people lived for years in refugee camps and in different settlements. And one day a woman presented with, I'm not a clinician, and I knew it was breast cancer, right? So you didn't have to have any clinical skill to know what she had. And no one treated her, but her medical records were like this. Because she moved from camp to camp, and every time she was seen by someone and they recommended treatment, and she had to move on. So fragmentation is a huge deal in terms of access And then there's this, right? So it took us, this is an article we published in 2018, it took us months to just get this done. And the point here, I don't expect you to get all of it, way too much. But what I think is important to understand is how complicated these relationships are. So it's never just one directional, and it's always going in different direction, but it doesn't, in fact, impact displacements and food security and energy poverty, which is something we haven't discussed at all. But we talked about people living in slums. Energy poverty is a huge deal in terms of coping mechanism and being able to resettle in their new places. And so one important point to remember is the weakness of the health system and system breakdown, which in some countries is the norm, and how much worse it gets during severe climate events when the hospital was washed away, right? This is the extreme case. Or, the nurses were washed away, which also happens. And then the breakdown of the system becomes an issue, and an issue in recovery. Because you do want to open the clinic again, but the building was washed away, or your pharmacy was washed away, and it's very hard to reopen the health services. But at the same time, while you're trying to maintain services for everyone, you also have to deal with disaster injuries. And I just described an area that had, 3 tropical storms in 4 years. So we were still taking care of people from 2019, and now we're dealing with people who are coming into our care now. And a lot of them are dealing with trauma, both physical and mental, which is also something to remember, and something we haven't talked about it much, but I thought about it with the context of political violence in town and how much of it relates to trauma and to people's sense of broken lives that comes with climate migration, especially after disasters. And then there's the health risks during escape. And here, some of it are physical health risks. People just grab their kids and they run when the flood comes. So this is, but also we were seeing long-term risks in cases of droughts, when it's mostly food insecurity and its long-lasting impact. And I'm going back to Malawi because this is what I feel the most comfortable talking about. But every time I come back from Malawi, all the children in Israel look really big and fat. And the reason is that almost all the children in Malawi are between moderately malnourished and severely malnourished. And almost all the children we see in the clinic are stunted. So they're not growing, or Israeli kids are really fat. These are the two options. But the point is that food insecurity is something that affects families long term. And the question of just managing both chronic and acute illness. So Malawi is one of those fantastic places where people can go and get HIV meds from the government for free. At this point, not everywhere, but almost everywhere. But people like Clara lose it when they move away or when the clinic collapses. And so just reopening and allowing people to receive chronic care, especially in healthcare systems that have worked so hard to establish these mechanisms, is one of the biggest challenges that we can think of. And then there are the ones who do move out. And we said it many times today. This is a minority. Very few people manage to actually get out and migrate to other countries, even to neighboring countries. So people, try to move to South Africa, try to move to Mozambique, and then they come back to receive healthcare services. So this is still a challenge. But if you manage to move further out, then you're not necessarily going to land in a place that's actually going to provide you healthcare. And this is something that people think about as they try to figure out their own welfare. Remember the broad definition of health, their own welfare and their family's welfare. And the issues of just health rights, so questions of access, you can cross the border and lose all your rights. For some services, you can move district or just be out of your own hospital and you lose a lot of your rights. And especially in areas that don't necessarily speak the language of right. This is not something that you can come and demand. Then your sort of ability to achieve health or to get what you need is going to be limited by these limitations. And so I know Sheila is going to yell at me in a second, so I'm going to rush to conclusions and just a few thoughts. For me, I think the biggest surprise, probably because I'm an idiot, was the things I didn't think about. We were doing our work in our HIV clinic, talking about integration of care, being very excited about it. And then this cyclone hit and it changed everything because the clinic shut down. And a lot of work that was done for years was just gone. And a lot of it was about recovering. And then it happened again. And then it happened a third time. And in a lot of the areas that are now facing climate events, and we talked about it earlier, this is not the first time people have had to cope with floods or droughts. So this is not new to them. And we talked about the global challenges, and we talked about the difficulty of adaptation. And I just want to end with this. So where does it take us? And I feel like a lot of other people, I don't have one answer, but I want to go back to responsibility, empathy, and solidarity, because I think we're losing it sometimes. And a lot of the answers are there. And it's in the collaboration that people talked about. It's about not necessarily taking what Westerners are saying about other places. And it's about figuring out ways, solutions for things we cannot compensate for. I'm done, Sheila.